Hey nurses, I'm Kavita, your NCLEX mentor, and today we are going to take up NCLEX next gen question and we'll try to cover all parts of this question. So let's start. The question goes, the nurse is caring for a 28-year-old client and we can see here the nurse's notes are given when the nurse is receiving the client, and the vital signs also we will see, and then the question will appear. So this is the first part of this question. So nurse's notes: at 8 a.m. the client was brought to the emergency department by the parents. The client is 28 years old, remember, after taking an unknown number of tablets 3 hours ago, and it is an unknown number. The client was found with empty prescription bottles found on the floor nearby. So empty means maybe he has taken a good number of tablets, but right now we don't know what that tablet is. The client is lethargic, mumbling incoherently, arouses with repeated physical stimulation only, not even by calling his name. He is arousing only with physical stimulation and is oriented to person only. He's not oriented to time and place. Face is flushed and skin is hot and dry. Pupils are equal at 5 mm and react sluggishly to light. Breath sounds are clear bilaterally. S1 and S2 are heard. So these are normal findings. Then peripheral pulses are 2 plus, that is also normal. Abdomen is soft but hypoactive bowel sounds in all four quadrants, and suprapubic fullness is also palpated. So these are important findings on receiving the patient. Then let's see what are the vital signs of the patient. Vital signs: temperature is high, you can see 101.4 degree Fahrenheit. Patient is also having tachycardia. Pulse is 120 per minute. Respiration is okay. It is 16 right now. Blood pressure is very low, 88 upon 58 mmHg. SpO2 is 99% on room air. So we can see here the problem is with temperature. Tachycardia is also present and blood pressure is very low. So hypotension is there. Now, based on these nurses' notes and the vital signs, the question is, this is the first part of this case, the first question: which four client findings require immediate follow up by the nurse? Select all that, apply. So you have to select all that, apply, but only those four findings which require immediate follow up. So there might be more than one findings which require immediate follow up, or maybe all six are important, but we have to focus on the priority, which is four findings which require immediate follow up. So you can see the options: blood pressure, heart rate, pupil assessment, bowel sounds, mental status, or suprapubic fullness. So you can take a pause and think what could be the answer. Then I will just discuss. Okay, so correct answers are, out of all these six findings, we will focus immediately on the blood pressure. You can see it's very, very low. So patient is in a state of hypotension. Then after blood pressure, you can see heart rate, tachycardia, pulse rate is very high. That is also a priority. Then mental status, because major mental status changes we can see in the patient. His speech is affected, his orientation is affected, and also suprapubic fullness, which could be very fatal for the patient. So these four are our top priority. Then bowel sounds and pupil assessment also are important, but four if we have to choose, so these four are more important. So what is the reason for choosing these answers? When a client usually comes to emergency department, and in this case we can see he is in a state of acute crisis because he has taken some medication overdose, and we should always focus on airway, breathing, and circulation when the client is admitted, right? So here clearly we can see tachycardia and hypotension are very evident in the patient. So that is why we have chosen option A and C first. Then we can also see that patient has acute changes in the mental status. So that is also often related to underlying medical conditions or maybe some medication overdose, which is in case of our patient. So clients with acute mental status changes, they should be as first assessed for the precipitating factors. That is why we are focusing on that so that it doesn't get worse. And if we talk about the suprapubic fullness, why it's important, the patient is already having some anticholinergic effects like dry and warm skin, enlarged pupils are there, hypoactive bowel sounds are also present. So, all of these findings suggest that there is urinary retention which has caused the suprapubic fullness in the patient, right? So, this needs to be relieved immediately because this can cause severe pain in the patient. Hydronephrosis can occur, which is excess fluid buildup in the kidneys, and this hydronephrosis can also increase the risk for urinary tract infections. Moreover, the pressure which is created because of this urinary retention, it can lead to acute kidney injury also. So that is going to be more fatal for the patient. That is why we are focusing on option A, C, D, and F, right? And the other options, bowel sounds and pupil assessment, these are also important, but immediately not problematic as much as the other four options. So these are the correct answers. Now we will move to the next part of the question. So the next part of the question is here on the screen. The nurse's notes we have already read at 8 a.m. what it was. Now we will move on to the nurse's notes. You can see here. Just give me a second. Nurse's notes are again given at 8:15 a.m. Okay. So what is the status of patient at 8:15 a.m.? Let's see. Home medications have been entered, which the client was already taking. So home medications are amitriptyline, 50 mg per orally once daily. So which is an amitriptyline is a tricyclic antidepressant. Then docusate sodium, which is given for constipation. That was also the patient was taking that. Then hydrocodone, which is an opioid analgesic. So he was taking that also for pain. So these are the three drugs, and why this history has been taken. Usually we do take for all patients, but just to find out which of these drugs could have caused the overdosage in case of this patient. So we are going to correlate clinically with the signs which are presenting in the patient. Apart from that, vital signs again we have already seen. These are given. So keeping in mind these medications, amitriptyline, hydrocodone, or docusate sodium. So we have to choose between the effects of hydrocodone and amitriptyline, which we need to know. So prominent signs we have marked earlier also. You can see here. Client is lethargic, mumbling incoherently, arouses with repeated physical stimulation only, right? Oriented to person only, face is flushed and skin is hot and dry. Pupils at 5 mm means pupillary dilation is there, and react sluggish reaction of pupils is there. Then abdomen, hypoactive bowel sounds, and suprapubic fullness. And among the vital signs, the patient is having fever, tachycardia, and hypotension. Now, based on these, the question, second part of this case scenario is, I'm showing you on the screen, but these answers are already marked, so we will just first discuss the options. The nurse has reviewed that information. We have also reviewed that. For each finding below, click to specify if the finding is consistent with the disease process of opioid overdose or tricyclic antidepressant overdose. So, which of these two drugs has caused overdose in case of our patient? Now, this kind of question comes up in the Nextgen pattern. Each finding may support more than one disease process. So, in these types of question, findings will be given to you. It's kind of a table. Then, is it opioid overdose or is it tricyclic antidepressant overdose? You have to tick mark on the boxes. So, one finding can be present in both overdoses also, or in like two types of diseases can also have similar findings, but when you tick mark all the findings at the end, you will be able to clearly see that which of these two options have more tick marks. So usually that will be your answer, and then we will come to a conclusion which overdose the patient is suffering from, right? So here the options have already been marked. So first, I will just briefly review in case of both of these, what are the signs in the patient. So if we talk about tricyclic antidepressant overdose, mental status changes are there, drowsiness, delirium can occur, then seizures can also occur, which is not present in case of patient. Respiratory depression can occur in tricyclic antidepressant overdose, but it is a late response, not early response. Whereas usually in opioid overdose, respiratory depression is seen early, right? Then in tricyclic antidepressants, tachycardia, hypotension are present. Prolonged PR, QRS, QT intervals may be present. Arrhythmias can also occur. Then anticholinergic effects are also seen, like dry mouth, blurred vision, dilated pupils, which all we can see in our patient also. Urinary retention, hyperthermia, flushing, all these signs are actually present in the patient. And if we talk about the effects due to opioid overdose, then usually patient has affected effects in the mental status. Then, as I mentioned, decreased respiratory rate, shallow breaths are there, which is not present in the patient. Then meiosis or pupillary constriction is there, so that is contradictory to our patient's findings. Then bradycardia can occur in opioid overdose, but our patient is having tachycardia. Then decreased bowel sounds are common to both. Then opioid overdose usually causes hypothermia, whereas in our case, patient is having hyperthermia. Other signs in opioid overdose could be like prolonged QT intervals can be there, right? So these are minor differences and major changes. Now see the options. You can see here. These are the findings, and already the tick marks are there. So you have to actually tick mark on the boxes. When you click on the boxes, it will be tick mark when you do attempt the NCLEX exam on your own, on your practice or final. So in our case also, you can see on the screen heart rate 120 per minute, which is present in tricyclic overdose. Altered mental status is present in both. Hypoactive bowel sounds present in both. Then high temperature only in antidepressant overdose, facial flushing, hot and dry skin, and dilation of pupils, sluggish reaction. So you can clearly see all tick marks are present in tricyclic antidepressant overdose. So we can come to a conclusion that patient is having an overdose of amitriptyline and not opioid overdose. So that makes the answer clear. So this is just for your practice. You can see this kind of boxes you will get, and you have to tick mark. Sometimes two diseases are given and you have to tick mark this finding is present in one first disease or the second disease. And if you actually know the disease properly, then you'll be able to answer. And each column in these kind of questions must have at least one response option selected. So you cannot leave for any symptom or finding, you cannot leave both boxes blank, right? That will lead to like deduction of marks. And in such type of questions, if the whole answer is correct, like all tick marks should be at the correct place, then usually you get the full marks for these questions. So this is the second part of our case scenario. I hope it is clear. Any of the options or discussions, if it is not clear, you can definitely message and I will respond. Now we move on to the third part of the same question or scenario. Okay, so next part of the question is the same patient scenario and the findings we have seen already. Now the question is, which of the following actions should the nurse take? Select all that apply. So we have seen that we have concluded from our previous answer that patient is having an overdose of tricyclic antidepressant or amitriptyline. Based on that, which actions should the nurse take? Select all that apply. So there are five options. Now you can take a pause and think and then check the answers. So there are five things which we can do. Insert a peripheral venous access device, obtain supplies for an indwelling urinary catheter. So venous access, urinary catheter. Then prepare client for electroencephalography or request a prescription for 12 lead ECG or request a prescription for IV fluids. So out of these five, we have to choose those which the actions which the nurse should take, right? So answers are A, then this one B, then D, and E. Okay, so option A, I will just circle B, D, and E. These four actions we are going to take, or the nurse is going to take. So, what is the reason for that? Since now we know that patient is having tricyclic antidepressant, intoxication can be fatal, right? So, our interventions should be, first, we will insert a peripheral vascular access device as patient is clearly having hypotension and compensatory mechanisms of body have been activated. He's having tachycardia also. So IV access is needed because we will need to administer fluids and medications to the patient immediately. Then if we talk about the other option of indwelling urinary catheter, because clearly the patient is having suprapubic fullness, so that means urinary retention is happening, and immediately catheterization has to be done. Otherwise, as I mentioned earlier, kidney damage can also occur. Then the D option, which is requesting a prescription for 12 lead ECG, so that in any case, if there is cardiac dysrhythmias, we have to discover it earlier so that we can take appropriate actions in case of our patient, because as I mentioned, one of the signs of tricyclic antidepressant overdose could be widening of QRS complex, right? So for that we need 12 lead ECG. So before the cardiac arrhythmias occur, we will take an ECG well in time and prevent the complications. And option, request a prescription for IV fluids, the E option. Obviously we are inserting the venous access device for that only, which will be required as patient is having very low blood pressure. So we need to work on that. Then other option which we have left is preparing for electroencephalography. That is not required because it is to diagnose seizures and to evaluate any kind of abnormal electrical discharges in the brain. But right now the client is not experiencing any seizures, so we can do it later on if required, but right now it is not required. Okay, so I hope this answer is also clear to you. Then the next part of this question. So the next part is of this that same scenario is here. We have already seen the nurse's notes at 8 a.m. and 8:15 a.m. and vital signs also we have seen. Now, based on these findings of the patient, the question is complete the following sentence or sentences by choosing from the list of options. After administering, after, please remember this, it is after. I will just highlight it, just a second. Okay. So the question says after administering a prescribed IV fluid bolus, the bolus has already been given. The nurse should prioritize. See, usually prioritize is highlighted, immediate word is highlighted. So that is a clear indication that what is our priority out of all the options. Maybe more than one option is correct, but the priority you have to choose. So after administering a prescribed IV fluid bolus, the nurse should prioritize administration of dash to dash means the question asks she should prioritize administration of which of these. So when you click on this box which says select, here if you click, the drop down box will come up and options you can see here. She should prioritize administration of diazepam IV or activated charcoal per orally or sodium bicarbonate IV. Which of these she should prioritize? Two, again you click on this drop down box and you have to also mention if you are prioritizing administration of any of these three, then why you are doing this. So, two, increase the seizure threshold or to decrease absorption of excess medication or to reduce the risk of life threatening arrhythmias. So you can see these both boxes are related. If you choose diazepam, you should be knowing why you are prioritizing diazepam. To do what? Increase the seizure threshold. That has to be correct. Sometimes if you choose the correct option on in the first box and second option is wrong, that means you are not clearly aware of the concept, right? So both boxes you have to choose very carefully the correct option. Whatever you choose for box number one, is it diazepam, charcoal, or sodium bicarbonate, the second option also has to be correct. That means you know why you are giving this drug, what is the action of that drug, right? So in our case, um, diazepam right now is not required clearly, as I mentioned earlier, because there are no signs of seizures till now. Then activated charcoal may be required to decrease absorption of excess medication, but priority right now is giving sodium bicarbonate IV to the patient to reduce the risk of life threatening arrhythmias. That is our priority, because when we are choosing the priority, it should focus on, as I mentioned, airway, breathing, and circulation. So we have to focus more on preventing cardiac arrhythmias, right? So you will click on prioritize administration of sodium bicarbonate. Then when you click on the second box, out of three options, you have to choose to reduce the risk of life threatening arrhythmias, right? So whenever you are treating a patient with tricyclic antidepressant overdose, the priority will be administration of IV fluids, and sodium bicarbonate has to be given because it will neutralize the toxic levels of the TCAs by reducing the drug's receptor binding ability. Right? In simple words, we have to raise the blood pH and also increase the extracellular sodium concentration, which will help to narrow the widened QRS complex and also reduce the risk of life-threatening arrhythmias, right? So sodium bicarbonate has to be given in our case of patient. Then if you talk about other options, then as I mentioned, lowering the seizure threshold, increasing risk for seizures, etc. This is not required right now, and in our case, it is not clearly evident any signs which will ask us to administer diazepam right now to the patient. Currently, no scissors are active in the patient, so we will not choose diazepam. And the other option is activated charcoal. It is a, if you're not aware, it is a highly absorbent powder which binds to the drugs, ingested drugs and toxins in the stomach, and it can decrease the absorption of excess medication when there is a medication overdose. But in this case, it will be administered after uh, or in any overdose case. The main problem is that activated charcoal has to be administered shortly after drug ingestion, usually within 1 to 2 hours only. But in our case, the family has reported that patient ingested something or overdose of medication has happened over 3 hours ago. If you can see here, it's mentioned unknown number of tablets 3 hours ago. So these are minor things which we have to keep in our mind. Activated charcoal is effective in this case, but one important thing to remember is it has to be administered within 1 to 2 hours. So then also patient is having severely depressed mental status, so we it is likely unable to protect the airway or take oral medication, right? And he's very his mental status is also affected. He's not very much conscious. State is affected. So per orally giving activated charcoal, that also you have to focus on. Per orally we will try to avoid at this stage, right? So the priority intervention for tricyclic antidepressant overdoses, administration of IV fluids because of fatal hypotension, and IV sodium bicarbonate. Please do remember this. Okay, so this is the last part of our case scenario. So the nurse's notes, you can see we have already seen what are the important findings, and then the last part of the question is here. We have seen that what could be the like overdose in patient and what should be the immediate actions the nurse is going to take, and what options we chose to administer and for what reason. That type of questions we have already done. Now the last part of this question asks, the nurse has reviewed the information from nurse's notes and vital signs. So here you can see till now we had seen nurse's notes at 8 a.m. and at 8:15. Now at 10 a.m. some nurse's notes have been added. Nurse has initiated IV fluid administration, which we have done in the earlier option of this question. There was a part of this question. Then after initiation of IV fluid administration at 10 a.m., the client remains lethargic and oriented to person only, still mumbling incoherently, face is still flushed, skin is hot and dry still, which was present earlier also, pupils still sluggish reaction, And other breath sounds are clear. Cardiac monitor shows sinus tachycardia, which was also evident from his high pulse rate, and wide QRS complexes can be seen. That is why we chose sodium bicarbonate in the last option. If you remember, peripheral pulses till now are okay. 2 plus peripheral pulses is normal, right? Abdomen is soft now, and hyperactive bowel sounds are still present. But now the nurse has already inserted indwelling catheter. So after insertion of catheter, there was 500 ml of straw colored urine. We'll continue to monitor response to IV fluid administration. So a few changes which have happened here are that abdomen is soft now, and cardiac monitor is showing sinus tachycardia, and urine 500 ml of urine has come out after catheter insertion, and abdomen is soft. So based on these now, the last part of the question says the nurse has reviewed the information from the nurse's notes and vital signs. Drag words from the choices below to fill in the blank or blanks. So this is another type of next gen question. So we have to drag the words. You can click on the option and then drag to the box. So there are three boxes. Question is, the need for further IV fluid administration is determined based on the client's what three findings? So please answer this type of question very carefully. The need for further IV administration is determined based on what? Is it heart rate, temperature, wide QRS complex, urine output, or blood pressure? You don't have to answer what is important generally. Specifically related to IV fluid administration, you have to choose, which means based on which out of these five options your patient will get further IV fluids administration, right? So you can think of the options. The correct options, which will actually decide how we are going to give IV fluids to the patient, are option A, heart rate, B, urine output, and D, blood pressure. These are directly related to IV fluid administration to the patient. So you will click on heart rate, drag it to this first box, then click on urine output, drag it to second box, and blood pressure, just click on it and drag. So it's easy to attempt such kind of questions, but just focus on the question, what exactly it is asking, right? You might think that now the new finding is wide QRS complex, but directly related to IV fluid administration. So that options you have to choose. So why we are choosing these options? IV fluid administration will be determined by patient's heart rate, blood pressure, and urine output only. So client's urine output of 500 ml, which we have seen here, it is that because of the urinary retention which the client was having because of medication overdose. So this is the previously formed urine 500 ml which has come out as soon as the catheter was inserted, right? So further urine formation depends only on cardiac output and renal blood flow. If cardiac output is low, hypotension is there, then or different organs of the body will be affected because organ perfusion will be affected, and which can also affect renal blood flow. So that is why urine output is important, blood pressure is also important. And if we look at the other options, the wide QRS complex and temperature, which we have left behind these two options, they are a result of the overdose of amitriptyline, and they should resolve as the body clears the circulating drug, right? And they are not actually related to inadequate circulating volume and tissue perfusion. So you can just summarize it by saying that we will prescribe additional IV fluids to the patient based on the symptoms like hypovolemia, hypoperfusion, like hypotension, decreased urine output, then compensatory tachycardia, which is happening in case of our patient also. So these are major things which will decide our IV fluid administration, right? And widened QRS complex and the increase in temperature, they will resolve as the body clears the circulating drug, but they are not directly related to taking decision about how much IV fluid should be administered. Okay, so this was the last part of this question. I know it's a very long question to discuss because we have discussed all parts of this question as I promised in the next gen question. I am hoping that this is clear to you how to attempt NCLEX next gen questions now. All mostly the different types I've covered, a few might be left, but still it's good for your practice. Please ping me for any doubts still you have in this question, why we have chosen one or the other option, why we haven't chosen any other option. So please feel free to ask and keep following my channel. I'll come up with more videos. Bye bye.